I'm so glad I say that each time because so we're now officially recording this this session, and it will become available within a few hours after this session, as well as the PowerPoint presentation. We actually added a few extras in there too for things. Someone asked about drug coverage for the needles, etc. So we've got some more little goodies in there for you. We're going to have a couple of polls in this, and we're kind of excited about getting things going. I want to thank BD Canada for their support of this. I think it's been a really good program, and happy that Pav's here to finish it off. I'll just let you know a little bit about Pav. Pav Ravi is a practicing pharmacist in Ontario and an independent healthcare consultant. She's worked in long-term care, retail, and specialty, and has a true passion for patient-centered care. And I would agree with that. I've worked with Pav in the past. She's been involved in the development of various educational modules, presentations, programs, and content for pharmacists as well as prescribers and other healthcare professionals. And she's worked in a lot of different places, and she's got a really good knowledge of the financial aspect of pharmacy as well. So take it away, Pav.
Thank you so much for that introduction, Ruth. And yes, it's always been a pleasure to work with you as well. And thank you everyone for joining me here today for the fourth module in your series on implementing injection technique in your pharmacy. So I know you've been enjoying the series and they've talked a lot about different aspects of injection technique, but today in this module, we're hoping to wrap everything up and put it together and letting you know exactly how you can implement injection technique in your practice and how you can have that as a value add and intervention for your patients. So today we'll go over a couple learning objectives. We'll find out what we discovered when we looked for lipos. So that was one of the things from the last module that we talked about, lipos, and kind of figuring out what it would look like if you asked your patients or you looked at it in your day-to-day practice from the last module. Review key elements to reinforce when supporting proper injection technique. We'll discuss how to ask your patients about their current injection technique and habits. So it's more of that, how do you start the discussion? How do you open the dialogue? So you feel more comfortable in some of the speaking points you can use when talking to patients. We will look at tools available to support proper injection technique, and this is all sorts of tools that are available to you, as well as learn how to implement injection technique in your pharmacy. And this is one that we really want to make sure that everyone attending today gets something that they take away from, because it's great to have the clinical knowledge and it's great to be able to put into practice, but really making sure that it's something that's implemented in your practice, not just once in a while, but as consistently as possible, is a huge takeaway for yourself as well as your patients. So without further ado, I thought I would open it up to talk about one of the questions or homework that was left off from your last module on understanding lipos. So the question was, and the experience was, when I asked my patients to show me where they normally inject their insulin, I found. So this was kind of asking you to see how your patients reacted when you asked this question. How many patients were open to show you how they were injecting their insulin? Were they checking for lipos? I'm not sure if anyone's had the opportunity to write in the Q&A box to see if there were any components that they found from this exercise from the last module. I don't see anything yet, but one of the things that I've personally found in practice is that when asking my patients about where they inject, I usually get one of two different types of patients. I get patients who are really open and have no problem in lifting off their shirt, showing me exactly where they inject. They're completely open and very liberal and comfortable in speaking to me. But then I also get another subset of patients who are a little more shy. They may be more conservative. They're not comfortable exactly pinpointing where they inject. And they usually give me the answer, oh, I inject in my stomach. I'm okay. I'm comfortable with it. Oftentimes for this, I found in practice something that we can use is a diagram. So I usually have a torso as well as an injection diagram ready. There's one in the fit recommendations that you can utilize. I have it in the counseling area as well as just a laminated copy on checkout or where the POS system is. So when I have that quick counseling, I can actually pull it out if needed. And it really helps those patients who are a little bit more shy. So I'm sure a lot of you took the last module and had to think about that. So if during this presentation you have any other questions about the experiences you had or comments, please feel free to share. So I thought we'd start off the module in asking a polling question. And so the question was, currently, what do you feel is your biggest challenge to implement injection technique with your patients? So if you could pick one of the following, and I see Ruth has launched the poll, which one do you feel you're have the biggest challenge towards? Is it workflow? You're not sure how to introduce the topic to your patients, how to implement it? Is it patient engagement in the sense that you don't know how to speak to your patients about it? Do you feel like it's a topic that you don't know the exact vocabulary that they'll pick up and how to really get them interested in? Or is it clinical? Are you unsure of exactly what the components are in injection technique for your patients?
There, we've got quite a few votes already. It is awkward at first,
Yes. It's definitely, it's a little bit, some people find it like an intrusive question, being like, oh, it's like something I do to myself. Why are you asking? But it's a really important question to ask.
Need to practice on, I always say, practice on your grandmother.
I'm not sure how she'd feel about that.
Well, practice asking.
Oh, yes. Okay, there we go.
Someone you're comfortable with.
Yes, that's fair.
Yeah. Yeah. Let's see if we can get to 70%. Come on, guys. Just need a few more people. Almost there.
But it seems like the first two are probably the more common ones that people find as a challenge.
Yeah. Okay, I'm going to end now and I'm going to share the results. There you go.
Awesome. So it seems like number 2 was the one that people find the most challenging, patient engagement, how to introduce it and actually have patients want to proactively take part on their diabetes management and engage in injection technique. And then number 2 seems like it's workflow, just figuring out where in the workflow to introduce the program and who should introduce the program. So hopefully through this module, we'll hit some of these topics and answer those for you.
I'm going to
All right, I'm just going to close this off my screen. So I thought we'd talk about reflecting on a study that you've probably heard about through the series of modules already. It's insulin injection practices in a population of Canadians with diabetes. And what I really wanted to highlight from the study is that it looked at 24 physicians who were recruited, 15 were family practices, 9 were specialists, and of those asked, about 90% of them felt that injection technique is something that's really important, that we should be conversing to our patients about, and they should be educated on. But similarly, it was also a topic that a lot of those physicians felt that they were doing a good job on conveying to their patients, but it actually found out that there was almost 30% or a very low percent, specifically in family practices, that actually spent the adequate amount of time engaging with their patients to make sure that injection technique was discussed. And some of the results that were found from the 230 patients who participated in this is that there were a lot of injection errors that were occurring. Of all the patients in this population, it was found that every single patient had at least one injection technique error that they were doing. So that's a huge percentage of patients that had some sort of an issue with the way they were injecting their insulin. It was also found that the top errors that were done by patients were injection force, the size of the injection site, the duration of needle in skin, needle reuse, and then it fell down towards using the right needle, making sure it's 4 to 5 millimeters, as well as injecting into lipos and the length of the needle pen needle that was being used as well. So these were some of the errors that were identified through this observational study. And it's really interesting because when you think about it, it makes sense that injection force is something that we find our patients are not fully aware of. It's a hard concept to grasp, and especially for patients who may have been brought up or may have the preconceived notion that if I put more muscle into it, it's going to be better. I know I'm guilty of this. For example, I always, for a long time, had the belief that if I brushed my teeth harder, it would come out better. So it would be cleaner, my teeth would be better, but it's actually detrimental for you. It recedes your gum line. So similar to this, patients may have the misconception that they feel the more forceful I inject, or the more force there is in injection, the better drugs being administered into my body. But we all know that this is actually opposite to what it does. The more forceful you are, the higher the risk of an IM injection, and the higher the risk of an IM injection, the more swings and possible hypoglycemia that patient might see. So how do we address this with our patients? It's an interesting topic. It's one that we can definitely explain verbally, but one of the things that kind of works hand in hand in making sure that we explain why force is so important to them is making sure that they're using the right type of needle and the right needle design. And studies have shown that using a contoured-based needle that is of lower length is beneficial to our patients. It basically adds as a mitigation to the amount of force that a patient applies. So for us, that basically means because the surface area is larger than you'd see in a posted tip needle, you're going to have that force distributed more widely. And that way for patients, the force doesn't indicate that the needle will fall further in and possibly result in an IM muscle. But this brings up the topic of, in practice, how do I explain this to a patient, especially if they're not comfortable with it or they're not understanding the terms that I'm using and trying to use the most lay terms as possible. One thing that I found that works really well when implementing counseling on this topic is using a stress ball. So if you use a stress ball, it's not exact, but it can mimic the way force reacts on skin. So it gives patients an idea of what force does. And you can literally use anything you'd like. If you have a pen needle as a demo, or if you have anything that's pointed and something that's a little more blunt, it's really easy to show the difference to a patient. And oftentimes what I use is a pen. And if you see the pen, when it has a tip that's kind of pointy and a bit more length to it, it's similar to a Post-it, as opposed to a pen that has a more blunt surface to it. So if you show that that force that's applied to the stress ball doesn't cause that dimpling or those skin lines in patients, it helps them understand that when you implement that force for something that's posted, it's more likely to go deeper into your skin, and it's more likely to end up with an IM injection, and for them to understand why using more muscle or more force is not necessarily something that's beneficial to them. So this is a demo or a picture of kind of the demo that I just described. And this is something that I also have in practice. I like to have this in the counseling area because when you're having those one-on-one talks with patients, it really helps when they have a visual as to why force plays such a huge impact on their diabetes management, as well as why the design of their pen needle can have a huge impact on the force they apply as well. Because it's really easy for us to say apply less force. It's a lot harder for us to remember that information and apply it to each time we inject, especially for someone who's injecting maybe 4 times a day or 3 times a day, where if you're a creature of habit and you've created a behavior, it's hard to mitigate that. So in this diagram, it really shows that if you have a posted tip needle, which most needles are, you're gonna, with the same amount of force, you're gonna have the potential of having that needle go closer towards the muscle. And once it's a muscle injection, it has the ability to cause swings in blood sugar, hypoglycemia, and really disrupts the patient's management of their diabetes, especially if they're a patient who's newly diagnosed, because it's really important they see that their behaviors and their new therapy is actually making a difference in managing their disease state and their condition, and it can help them feel more engaged or empowered in that control of that disease. And you can see here, if the contoured base, the force is basically mitigated out because there is a larger surface area. It's not pinpointed down to where the needle is. There's a less risk of a muscle injection or an IM injection. And it really is based on the FIT recommendations. They've identified that this needle design compared to the posted in studies has a huge impact in preventing those IM injections and potential hypoglycemia and blood sugar swings. Another concept with injection force that's often an error that in injection technique that you'll see patients experience is rotation. So rotation is one of those questions that are hard to gauge with patients because a patient's so quick to answer, do you rotate? Yes, I do. But it's been found that more often than not, patients who think they're rotating aren't rotating their injection site properly. So there's kind of a couple rules and a couple tips that I use in practice to help me explain this to patients. When asking about rotation, I definitely ask them to demonstrate what their day-to-day rotation looks like. And I found a couple things. Some patients think that they're rotating if, for example, they're injecting 4 times a day, and for each site they're going between site 1, site 2, site 3, site 4, but then the next day it's the exact same spot that they're injecting for site 1, site 2, site 3, site 4. And that's not necessarily proper injection technique and proper rotation for your injection. What we really want to make sure our patients are doing is recognize that these quadrants, that you can call them, that if they're injecting in their abdomen or their stomach, that they divide it into 4. They identify 1, 2, 3, and 4. And if they have multiple injections in that day, make sure that they're using some sort of rule of thumb. I usually say 2 finger lengths. And if they have maybe 3 injections a day, start from the left and move to the right. So I always say, go to the most left point of that quadrant for your first injection. Then for the second injection of the day, move 2 fingers towards the left until you hit that center line where the belly button is. You don't want to go past that. And so making sure that you always go from left to right, and for each day it's a different quadrant, helps them remember proper injection technique and rotation. And it's completely up to you. If you think that going from top to bottom is easier to remember, you can recommend that. But what I find is, don't give your patient too many options. Be really clear, be very concise, and say, each quadrant, 1, 2, 3, and 4, is for a separate day. And within that quadrant, move from left to right for each injection or top to bottom. So that's usually one of the techniques I use in practice to help patients understand injection site rotation. Another error that I see a lot from patients is the size of injection area. So I once had a patient who's injected twice a day, and they had told me that they rotate their site of injection. However, their site of injection was about the size of a postage stamp. So it was always right next to their belly button, but it was just on opposite sides of the belly button. And they truly believed that they were doing site rotation and appropriate size of injection area for this. And because of that, and a couple other experiences I've had, I usually use visual aids for this. So if in your counseling area, you can have either paper cutouts or even live visual aids of a playing card, a postcard, and a bank card, and a postage stamp, you can really ask the patient the question, what do you think is the appropriate size of your injection area? And more often than not, I've found that they believe it's about the playing card size area, where really they have an entire postcard size area they can play with. So that's one of the tips that I find helps when engaging with patients to help visualize and really take ownership of their diabetes management. So I'll stop quickly here for a polling question. It's really to figure out how these workshops have been working for you. And in this polling question, we're really looking to identify that we've talked about the various forms of injection technique. We've talked about needle reuse. We've talked about needle length and needle design. We've talked about injection force. We've talked about lipos. We've talked about site rotation and numerous other techniques that are important to engage our patients with. But how do you feel now with all this information given to you from your workshop about it? Do you feel more comfortable and confident answering questions from patients? Do you feel you would encourage your staff to ask more about needles when they see someone's an insulin using patient and they're dispensing that? Do you feel that you would pick one person to discuss injection technique once a week starting this week? So you know that you're going to give yourself a target to say that, you know, I might have 5 patients come in, but at least one I'm going to make sure I speak to. And are you going to start incorporating some discussions about injection technique when conducting meds check with appropriate patients? Because that's definitely something that can be addressed together and coupled together.
Thanks, Pab. This is where the rubber hits the road. They're
true.
To make changes in their pharmacy. We added value, and
yes.
I love the meds check. I'm really, I wanted to win. I wanted to win. Look at this, 72%. Fantastic.
Oh, it's so close. Yes.
Okay, so I'm going to, we got lots of people voting on this one. Yeah, I think, okay, now I'm going to end it.
Perfect.
So the winner is, it's
med check.
Yay!
You called it, which is a really good one, actually, because they go hand in hand. You know, you're reviewing a patient's medication. Insulin's one of their medications they're taking. The type of medication you take is important, but how you're taking it is just important. So I think that's great that everyone that's participating thought med check.
That's fantastic. I'm going to leave again.
No problem.
Okay.
So really, from all these modules, everything you've learned, it's really points to one key message. You want to make sure you reinforce proper injection technique, and you want to make sure you enforce it in a way that your patients are engaged and they're able to take ownership of that and really take empowerment over their diabetes management. And one of the tools that I often use in practice is the FIT recommendations. I know the full recommendations can be a larger pamphlet, and it's a larger book that you may not want to necessarily sit and read with your patients, but they have a number of 1 to 2 pages that are both healthcare professional facing as well as patient facing that you can use to make sure that if you discuss something with your patients, perhaps in that meds check, and perhaps rotation is something that they've suffered with and they're not doing appropriately, giving them that handout to take away kind of helps them recall and remember to try to engage in that good behavior and put it into practice, and hopefully it'll become a habit. Some other tools that I often use is some sort of a checklist. I know BD has one that's coming up, but even in practice, what I find that is when you're engaging patients who are insulin using, sometimes they're not always willing to have that one-on-one consultation with you. Maybe they're busy, maybe they've got to leave, maybe there's just no interest in that time. But what I've actually designed in my practice, which you may consider for yours, is we've got a number of really small, they're probably about playing card size, tiny little checklists, and they're colored green, and we basically laminated them. And when my technicians are filling a product that has insulin for a patient, they put that into the basket for me. So once I've finished my clinical check, if it's myself who's bagging it, I make sure I tag it. So I always have the saying that's called tag the bag. So we have, whether it's a paper clip or whether it is a clothespin or whatever you use to hold it together, we make sure that little leaflet's attached to it. So if I'm not the pharmacist that's practicing, whoever the relief or the individual who is has that opportunity to say, hey, this insulin using patient, I'm just going to ask these quick questions to them. And it really doesn't have to be anything too hard. You just want to make sure you hit all the topics of injection technique in a really brief and concise question. You want to make sure that you hit the pen needle that they're using is 4 millimeters with a contoured base. So are you using the right needle? That they're assessing for lumps and bumps for lipos. So are you assessing for that? Are you assessing for lipos? That they're rotating their site widely. So it could be like, are you, so rotation of site, are you rotating and what's the size that you're rotating? Are you applying light pressure? So just reminding them that more pressure is not necessarily better for them. It actually could end up with an IM injection that they don't want. And finally, are you using a new needle for each injection? And I know we've talked about this before, and it's ideal that it's a new needle for each injection, but it's not necessarily always possible for numerous reasons. So if we can kind of engage that patient to try to commit to reduce using the needle as much as they were, that reduction is also a win for us. So we've talked a lot about injection technique, and I've kind of mentioned a couple of the tips and tricks that I use through practice to help remind me to have that conversation with my patients. A couple other things that I wanted to talk about in implementing injection technique and training into your pharmacy is try to integrate it into medication reviews, which a lot of you said that you would, which is great. What I have in my practice, which you may want to consider as well, is I usually have like a really brief printout. So literally that mini size card that I have that's green and laminated on the bag, I have a larger version of that. I've utilized some of the diagrams from the FIT recommendations. Sometimes I actually print out the FIT recommendations as well. And I just put it into the package for the medication review. Because sometimes the patient's coming for the medication review, your pharmacy technician or assistant is printing it out, just making sure there's a folder or a file that they can reach into when they know it's an insulin using patient and put that into that package. So when you go through it with the patient, it's a reminder for you on what you need to touch on, but also it's a reminder that you can document everything you've talked to the patient about. So if they come back for a follow-up diabetes med track, or if they come back for some other reason where you have a follow-up on IT, you can refer back to that documentation. Has there been improvement? Have you checked their A1Cs? How's their blood sugar fasting and postprandial doing? And it's kind of a two-based scenario where you're now exercising an intervention that helps you see the impact you're having on your patient because you have documentation, but it also helps the patient see what you've assisted them in and given them guidelines for really makes a difference in the way that they're managing their diabetes. And one point that I'm sure you've heard before is injection technique can have a huge impact on our patients. It can reduce their A1C in some chances up to 1%. So really trying to have that documentation and follow-up can be a huge component for that. Another thing I've done in practice is set up an appointment-based model, as well as we know that a lot of things have gone virtual now with COVID. So utilizing some of the models that you're using there for med checks or just in general appointments to talk about diabetes management is something that I practiced in my practice as well. I usually piggyback it to med checks so that it's kind of, you're doing 2 in 1 at the patient's convenience. The other thing you can do is host clinic days for awareness. So I usually work with, if there are healthcare providers next door, in my circumstance, there are physicians, I let them know that over the upcoming month or a couple of weeks, I'll be hosting like clinic days for diabetes awareness. If there are nearby healthcare providers, I try to integrate them as well, so there's more awareness in the community. But the other thing I do for clinic days is I often do a report to see what patients are currently insulin using or diabetic, and I try to get them in to have that talk, if possible, for a med track or just an appointment to have that one-on-one consultation, or at least come into the pharmacy if they're due for a refill so they can engage at least with that brief conversation at point of sale or checkout where you can at least mention those 5 points of injection technique to them. As I already mentioned, you can flag insulin using patients as they come into the pharmacy. So we use the green laminated card, but you could really use anything. You could use different colored paper. You could use stickers. I've seen that used before. I've seen people flag it in the system, and some systems they let you do that so that when you're at clinical check, you can actually see that this patient's been flagged as an insulin using patient. Make sure you ask or consult about injection technique. And finally, utilize clear tools to personalize your approach. So a couple of the tools that I've used for myself as well as my staff is, how do I engage with that patient? This was one of the questions that were, or answers that were given. That's one of the challenges that you face. I try to have the discussion about injection technique when they're coming in to drop off their prescription, if possible. I've usually given my pharmacy assistants or technicians a few talking points, really simple, that, hey, would you have some time to talk about injection technique when you're picking up the prescription? It won't take more than 5 minutes, just to level set the expectation. I've also had, if they're calling in for a refill of insulin, I've asked my staff to have that same discussion with them. So a patient knows that, hey, I've got to set aside that time to have that discussion with you. And for myself, when I'm trying to approach a patient, I try to make it as personal as possible. So rather than saying, how are you doing with injection technique? Do you feel you're doing well or bad? I try to probe on the 5 points to make sure that maybe they haven't thought about something, because you don't know what you don't know. I also try to engage in a conversation about how their diabetes is doing in some cases, where it helps to set care plan or like personal goals if they have a more personalized approach. Perhaps they're a new grandparent, or perhaps they're looking to have children. Just making sure that managing their diabetes is something that's important to them, and that this is something that's really easy that we can help them with. It's not another medication. It's actually optimizing the medication that they're already on. And finally, the most important thing is to have follow-up protocols, because oftentimes we come up with new initiatives or new things we want to do in practice, but it may last for a month and then it falls short. So whatever you try to implement in your practice, just try to make sure there are 2 things. It's sustainable for the number of staff that are there so that everyone can participate and the workload is shared. And 2, there are clear operating procedures that are documented. So you know that if your staff members change or a new staff member comes on board, it's kind of the same experience that your patients get regardless to who's actually catering to them. So really that kind of brings us to the end of our presentation, and it brings up the question, what's next? And what's next is to really implement and practice what you've learned. So hopefully I've given you a couple tips that help you better understand, and really there's no timeline. You don't need to worry about having everything put into place, making sure you have all your I's dotted and your T's crossed. It's just jumping into it and trying to put this into practice and implementing injection technique into your practice. And there is a hands-on session that's hosted by BD with their reps that you can have. So that's definitely, if you have more questions, something you can look into. But I wanted to end it with one more polling question. So now that we've gone through the whole gamut of injection technique and implementing it into your practice, what do you feel would help you implement this into your practice? Do you feel like it would be more clinical information, tools, checklists, or demos, patient handouts, or instructions on step-by-step guide to implement? This is one of the questions you can think about, but I believe the other polling question might be a little different. So I'm going to let Ruth launch it.
Actually, no, I didn't put this one in. I apologize completely.
Okay.
But you could put that in the chat or in the Q&A.
No problem.
And
Well,
there's
it's
also an evaluation at the end of the program. So, and there's text boxes to fill out if you want something in particular.
perfect. So really, it's kind of that question of where do you feel something would help you the most? I feel like clinical, we've probably covered quite a bit throughout this presentations and the series of webinars. But I know there's a number of checklists that are available through Diabetes Canada, through BD, as well as the FIT recommendations. But also, would you need a little bit more help in understanding how to implement this into your practice? Where and what touch points are best, just to get a feel for maybe what you'd like to hear more about in the future. So that brings us to the end. Sorry.
Thanks, Pav. I'm sorry pushing along here. Sorry.
No.
We actually got some people, they like the tools. And just a reminder, they're there in your program, in the actual course. We also have a couple of really good questions that I hope that you can answer. A patient of mine has had gastric bypass surgery and has lots of loose skin. Could he smooth down the skin and inject? Unsure of what to tell him.
That's fair. And I'm not sure if they're injecting into where exactly injecting into the abdomen, but ideally when you are injecting, it's better if they have loose skin, if they do smooth it down. You don't want them to stretch the skin, absolutely not, but you don't want it to unstable, I guess is a better word for it, because sometimes the skin can move while you're injecting. So just applying very light pressure to make sure the skin is firm but not taut, and then to inject into that.
Perfect, thank you. The other one is, you may not know, the BD Auto Shield Duo Pen Needle. Is that a contoured needle?
That is a good question. I don't know that off by heart, but I can certainly find out and get the answer for you.
Yes, okay. Yeah, well, I'm sure Robin will be able to help us. So, no, it's not. Look at that.
Okay, perfect.
So Robin's on
no,
there.
it is not. Perfect.
It's a safety needle. Okay,
okay.
Well, thank you so much, Pav. You were great. I know lots of stuff to think about. I'm really encouraged by all of you that, you know, you're here, you're thinking, you're looking for stuff. You know, Pav gave you amazing help at the end there with just, you know, start small, have something in your hand, like I said, practice on your grandmother, like just how do you introduce that? Just think about how you're doing it, and then and use everybody in your team to help you, because it's a simple thing to do and it can have powerful, like 1% drop in A1C. Now, isn't that the same as adding a drug to the regimen? I mean, like, so there's lots to do. I want to thank BD Canada for their support of this. I want to thank Pav for helping us out here too. And I hope everybody has a great day. Don't forget, go back in, do your follow-up. Every recording will be there, all the slides will be there, and all the tools will be there as well. And make sure that you finish off by the end of today. Thanks so much. Take care.
Thank you, everyone.
Have a good day. Bye.